Hey Bright Beakers, have you ever wondered what the real difference is between a psychopath and a sociopath? Some people might think of individuals who commit violent acts without remorse, but these terms encompass much more. Today we're diving into the nuances that differentiate these two conditions, understanding psychopaths and sociopaths, definitions, and diagnosis. Let's start with the basics. According to the Oxford Learner's Dictionary, a psychopath is someone with a serious personality disorder characterized by a lack of empathy, remorse, and a tendency towards violent behavior. Meanwhile, a sociopath is defined as someone who exhibits aggressive or dangerous behavior due to a mental illness. Despite their differences, both psychopathy and sociopathy fall under the diagnosis of Antisocial Personality Disorder. ASPD is characterized by a disregard for the feelings of others, lack of remorse, and violation of social norms and laws. One of the key differences between psychopaths and sociopaths is their origin. Psychopaths are often considered to be born with their condition, likely due to genetic factors. Research suggests that the amygdala, a part of the brain responsible for emotional responses, functions abnormally in psychopaths. They are calm when witnessing disturbing scenes and may even find them amusing. On the other hand, sociopaths are typically shaped by their environment. Factors such as childhood trauma, parental neglect, and exposure to harmful socio-cultural elements contribute to the development of sociopathy. Behavioral differences, planning, and impulsivity. Psychopaths are known for their meticulous and calculated behavior. They plan their actions carefully to minimize risk and are often able to mimic human emotions to blend in. This makes them particularly dangerous, as they can form superficial relationships to manipulate others for personal gain. Career-wise, they often thrive in high-stakes environments like law enforcement, medicine, or as CEOs, where their manipulative skills can be an asset. Sociopaths, however, are more impulsive and prone to emotional outbursts. Their crimes are often unplanned and carried out in the heat of the moment. This impulsivity makes them more likely to get caught. Sociopaths also struggle to maintain stable jobs and relationships, often working on the fringes of society in roles that require minimal social interaction. Emotional capacity. While psychopaths lack the ability to feel empathy and guilt altogether, sociopaths can sometimes experience these emotions, albeit inconsistently. This slight capacity for empathy means that sociopaths might form some genuine, though often unstable, relationships. Social interactions and relationships. Psychopaths are adept at maintaining a facade of normalcy. They can form long-term relationships and families without their condition being detected. Their high level of control over their emotions helps them avoid detection and manipulate those around them effectively. This ability to charm and deceive makes them particularly insidious. Sociopaths' instability. Sociopaths, by contrast, are often visibly unstable. Their impulsive behavior and aggressive tendencies make it difficult for them to hide their condition, leading to more chaotic and abusive relationships. They tend to make it clear that they don't care about the needs of others, resulting in extremely unstable and sometimes violent relationships. Examples in media. To put these traits into perspective, consider Jeffrey Dahmer from the Netflix documentary. He exemplifies psychopathy with his meticulous planning, fascination with death, and complete lack of remorse. Dahmer's ability to appear normal while committing heinous acts is a classic trait of psychopathy. On the other hand, Tommy from the series Power is a clear example of a sociopath. His impulsive actions and occasional remorse highlight the key differences between the two disorders. Tommy's tendency to act without thinking and his emotional outbursts are typical of sociopathy. Life and career impact. Psychopaths often excel in high-stakes careers, where their lack of empathy and manipulative skills can be advantageous. According to a 2013 study by Oxford scholar Kevin Dutton, some occupations attract psychopaths in large numbers. These include roles as police officers, attorneys, doctors, and especially CEOs. Their ability to mimic social emotions and manipulate people helps them climb the corporate ladder and gain respect and trust in their fields. Sociopaths in the workforce. Sociopaths, on the other hand, struggle to maintain steady employment due to their impulsive nature and inability to form stable relationships. They tend to avoid jobs that require long-term interactions with colleagues and prefer working on the fringes of society, such as selling drugs or engaging in other illegal activities. Their erratic behavior often leads to frequent job changes and difficulties in sustaining a career. Treatment options. Treating psychopathy is challenging due to the inherent lack of empathy and remorse. However, a combination of psychotherapy, behavioral skills development, and support from family and community can help manage the condition. Medication is usually reserved for patients who do not respond to other interventions, as it can sometimes mask symptoms rather than address the root cause. Treatment for sociopathy. Sociopaths may benefit from medication and counseling, although many reject treatment due to a belief that nothing can change their behavior. Treatment approaches for sociopathy often incorporate multiple modalities, including psychotherapy and behavioral skills training. However, the effectiveness of treatment can vary, and some sociopaths may revert to old behaviors once medication is stopped. Key differences recap. While both psychopaths and sociopaths are diagnosed under ASPD, their behaviors and origins differ significantly. Psychopaths are born with their condition due to genetic factors, while sociopaths develop it through environmental influences. Psychopaths are methodical and manipulative, whereas sociopaths are impulsive and prone to emotional outbursts. Social and emotional differences. Psychopaths can maintain a facade of normalcy, forming long-term relationships and excelling in high-stakes careers. Sociopaths, however, struggle with instability in both their personal and professional lives. They are more likely to engage in impulsive, aggressive behaviors and have difficulty maintaining jobs and relationships. Empathy and remorse. Psychopaths lack the ability to feel empathy and remorse altogether, while sociopaths may experience these emotions inconsistently. This slight capacity for empathy means that sociopaths might form some genuine, though often unstable, relationships. Impact on life and career. Psychopaths often excel in high-stakes careers due to their manipulative skills, while sociopaths struggle to maintain steady employment. Their impulsive nature and inability to form stable relationships lead them to work on the fringes of society. So, did this video help clarify the differences between psychopaths and sociopaths? Have you encountered individuals with these traits in your life? Share your thoughts and experiences in the comments below. If you found this video insightful, give it a thumbs up, and don't forget to subscribe to Bright Beak for more content like this. Check out our other videos for more on mental health and wellness. Until next time, we wish you a happy and healthy day.